All right. In this video, I'm going to walk you through an objection that we get, especially when we're reactivating past patients with email, text, voicemail drops, or even calling people. Very commonly, we'll hire someone that's actually getting treatment at that point. They're going to say, my doctor wants me to see either their physical therapist or another physical therapist. And so we kind of have to start to get a gauge of what that actually means for us. 90% of the time, it's really like a neutral kind of tone. It's really just the doctor said this, they have authority, and the person just like, sure, I'll go there. 10% of the time it's like, oh, they actually maybe had a negative experience with you, or maybe the actual doctor kind of had maybe one of their patients that had a negative experience. I'm not going to handle the 10% of they had a negative experience with you, because that's a product issue, not a sales issue. The normal one is going to be that just the doctor pretty much, they came in, they said either go to this list of PTs, not telling them they need to go there, or they're going to say go to our PT, because they didn't already know that they were established patient with you. And so we have to kind of overcome some of those type things. And so when we're looking at all this type stuff, we really just need to empower the patient to understand that they should follow the recommendation for physical therapy, but they should actually have the choice in who they do it with. And so the way we kind of do this is you're going to say like, hey, I understand your doctor's recommended physical therapy, but just so I have an idea, did he specifically say you needed to go to his, or that you just needed physical therapy and they just happened to kind of do that? Or they, you say, I understand your doctor has recommended you to their own physical therapist. Would it be okay if I kind of walk you through like why this sometimes happens? Doctors sometimes refer to their own physical therapist because they don't know you already have a good relationship with us. And so they're just trying to accommodate your needs, not really inherently realizing you'd rather see us. And so, did your doctor specifically say that you needed to come here? That you could? Did your doctor specifically say that you should not come here? Or was it more so just like, here's a list of people, or here's my thing and just go here? Not really inherently realizing that that was the case. They're like, usually most of the time that person's going to be like, no, like they told me to go here. They didn't know I was already established there. It's like, okay, I totally get it. Like that's pretty common. I wouldn't want you to move forward unless it actually makes sense and you're wanting to really work with us. But I assume since we already have a good relationship here, what we can actually do is actually get you scheduled, go ahead and call them, get the referral. So that way, since we already know everything about your history, everything like that, we could actually start to get that taken care of. Is that something you'd be open to? And so at that point, that's when you have the conversation, depending on where they are within their plan of care. Some people will actually be like, yep, I just started with them. I'd much rather be with Susan. Like Susan was awesome. Some of them will be like, I'm already here. Like they seem fine, blah, 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 blah. Don't fight hard on this one, because again, if this is a referring doctor, then we don't want to be ripping people out of theirs. But if they can frame it as something to where you can get them in and it's like, hey, like we're already established there, I like them, it's actually kind of a positive, because at that point they're like, oh, like dang, they're literally that good. So I don't have to feel bad if we do refer to them occasionally, if we have a wait list, stuff like that, or I at least know they're getting taken care of. And so at that point, you're going to schedule them. You're going to call the doctor to obtain the referral, and we're just going to make sure that you get them taken care of so they can start there as fast as possible. You then, of course, on the back end, need to look at insurance and seeing what actual things they've done. So that way, depending on how long it is, we're hitting different codes, and we've got, well, we won't get into billing here. And so that's really how you do it. This one is a tougher one to overcome, I will say, just because the authority of the doctor and depending on where they are in the plan of care. It's not very often we always like hit right at the start of the plan of care. The sooner they are within the plan of care, the easier it is to actually get them there. But we kind of want to have an implied assumption here that they should want to work with you, because if they don't want to work with you, we have a product issue most likely, and not really a sales issue, because people should be very, very, very eager to want to come work to you. So then the second question is, why were they not actually saying, I need to go work with John's whatever at physical therapy, whatever? Because that's the bigger issue to solve, but this is the sales one, so we'll leave it at that. So if this was helpful to how to kind of navigate this one's not as common if you're not reactivating your past patients, which you should, because really at any point, 4% of your past patient list is ready to come back in. So if we don't stay top of mind, what happens is exactly like this scenario. They go to the doctor, they refer to someone either on their random list of people or in-house, and then that patient can be forever gone if we don't actually stay top of mind. So quick little nugget for y'all on the marketing side: email your past patients, ask them if they have any actual surgeries scheduled before the end of the year. If you do that, that will allow them to be like, yeah, I'm planning on getting my knee done. So like you can then say, cool, when are you planning on doing that? Let's schedule you for physical therapy. Otherwise, they go there, they have surgery, they go to someone else, and then that patient's forever gone, and you don't have your biggest asset, which is your past patient list. So that's one of the ways you can kind of stay top of mind. People are going to tell you those type things, or they're going to say, I'm not planning on having these surgeries, but I'm having this issue. Then you get them back in as a patient. So hopefully this helps. If you want more trainings on sales, whether front office or providers, or even some of the marketing like we just talked about, just join School. It's a free community where you can ask your questions. We have trainings that are actually sequentially in order, very easy to navigate, mobile app, everything like that. But to make it to where it's even more customized for you, we have 2 group coaching calls a week, to where if you have any of these objections, you're wanting to get better at sales, you're wanting to help more people, we can actually customize this to where me or Dr. Robbie, my partner, can actually walk you through all of these things and help your front office or you or your providers have better conversations, help more people, make more money. So I'll see you on the next one.